SATA CommHealth Chairman, Mr. Tan Boon Jin, SATA CommHealth CEO, Dr. Kelvin Phua. Ladies and gentlemen, it is my pleasure to address you at the SATA CommHealth Conference on Here to Care for the Health of Migrant Workers. This is the first health conference in Singapore that focuses on the healthcare issues of our migrant workforce. Although I'm unable to be here in person with all of you, I'm deeply honored to share my thoughts with you through this message. Our migrant workers have contributed greatly to Singapore's development, including providing essential services and building our homes and common spaces. Over the years, the government has implemented various initiatives to support their health and safety. A major enhancement is the establishment of a dedicated primary care system for migrant workers from the construction, marine shipyard, and process sectors. This primary care system comprises a network of medical centers and clinics operated by medical service providers that offer accessible and affordable basic primary care to these workers. It is mandatory for employers of these workers to purchase a fixed-fee annual primary care plan offered by the medical service provider operating near to the workers' accommodation. The primary care plan allows enrolled workers to seek care at the medical centers with a small co-payment fee of $5 per consultation. This system has provided cost certainty for employers while encouraging good health-seeking behaviors of our migrant workers. The primary care plan also offers annual health screening for enrolled workers. This helps with early detection of health issues, including chronic diseases, and promotes holistic preventive care. Since the implementation of this system in 2022, 96% of enrolled workers expressed satisfaction with the quality of care and affordability of the primary care plan. With the help of our anchor operators of the primary care system, we proactively monitor the incidences of infectious diseases and work closely with stakeholders to detect any clusters. This helps to minimize the risks of large outbreaks and work disruption. As the largest anchor operator in MOM's primary care system, SATA CommHealth plays a key role in providing primary care for our migrant workers. Today, SATA CommHealth operates 3 medical centers and 2 in-dormitory clinics. SATA CommHealth also has 6 SATA CommHealth clinics island-wide that cares for our migrant workers. Through these facilities, SATA CommHealth provides quality and affordable care access to over 260,000 migrant workers in Singapore. I recall attending the opening ceremony of SATA CommHealth's Medical Centers for Migrant Workers in May last year. I'm glad to know that since then, SATA CommHealth has expanded its role beyond primary care by conducting outreach programs for migrant workers at the various recreation centers and dormitories. Well done, and thank you, SATA CommHealth, for your commitment and contributions to migrant worker healthcare in Singapore. Apart from providing migrant workers with accessible and affordable primary care, MOM is also working with our partners to raise migrant workers' health literacy. By doing so, we empower migrant workers to proactively take charge of their own health. We do this through 3 ways. First, we equip migrant workers with health information resources via an online multi-language health library. This includes preventive health education materials, practical health tips, chronic disease management, protective measures against infectious diseases, and ways to strengthen mental and oral health. MOM also co-designed with healthcare professionals a health notebook for migrant workers as a resource tool. This notebook serves as a health monitoring and communication tool to manage chronic diseases. With this, doctors can better track migrant workers' chronic conditions and motivate them to adopt healthier lifestyles. Second, we train migrant workers to provide immediate healthcare assistance to their fellow workers when needed. As of 2024, more than 1,300 migrant workers have been trained in basic psychological first aid. They become peer support leaders who can identify, support, and link distressed migrant workers to professional help and other resources. We also coordinated CPR and AED training for over 4,000 migrant workers to equip them with life-saving first responder skills. Third, we work with partners to raise awareness on health risk factors and adoption of healthy lifestyles. For example, MOM worked with dorm operators, employers, and our anchor operators on an anti-smoking campaign in May. The campaign emphasized the potential cost savings and health benefits that migrant workers could gain just by cutting back on their smoking. Together with our partner NGOs such as HealthServe, we also conducted outreach to more than 4,500 migrant workers on mental and physical health issues last year. MOM also partners our migrant workers directly. Our migrant worker partners are called the Friends of ACE, or FACE, F-A-C-E. Today, there are about 1,000 FACE volunteers. These FACE volunteers play an important role in engaging and strengthening social and mental health support for the migrant workforce. They serve as a bridge to improve communication between MOM and their fellow migrant workers. For instance, they help to translate materials and explain useful information at various health events to their peers in their native languages. They also support fellow migrant workers in need. All these efforts were possible only with a strong collaboration and consistent support of all our partners. Henry Ford once said, "Coming together is the beginning. Keeping together is progress. Working together is success." And on this note, I would like to thank all our partners and stakeholders for your commitment to improve the health of our migrant workers in Singapore. My deepest appreciation to SATA CommHealth for organizing this conference and bringing together experts, healthcare professionals, and stakeholders and advocates to pave the way forward to better healthcare for our migrant workers. I encourage everyone gathered here today to contribute research findings, best practices, and sustainable solutions to deliver cost-effective healthcare services for our migrant workforce. MOM will continue to work closely with SATA CommHealth and other partners to enhance the health and well-being of our migrant workers. I wish everyone a great day ahead. Thank you very much.